Well, it is 10:02 and it looks like we still have some people trickling in, but I wanted to just welcome everyone to our Understanding Healthcare Part 3, Transitioning into Medicaid Expansion. And in our first two sessions on Medicaid expansion, we really were talking about even before the vote was approved and then the hopes of it actually being implemented. And now we're excited to see this starting to happen, and PCAD, the Program for the Elimination of Cancer Disparities, has pulled together a really great panel of experts to talk about this issue and to think about how we continue to move forward and improve access to healthcare. So I'm Amy James. I'm one of the faculty here at WashU and with the Program for the Elimination of Cancer Disparities and the Colon Cancer Community Partnership. And I am just really excited to welcome you and turn this over to Dr. Keisha Wyndham.
Thank you, Amy. Once again, hello everyone. We welcome you to our webinar, Understanding Healthcare Part 3, Transitioning into Medicaid Expansion. And once again, everyone, I am Keisha Wyndham, the coordinator for Siteman Cancer Center's Program for the Elimination of Cancer Disparities, also known as PCAD. I welcome you to our webinar titled today, Understanding Healthcare Part 3, Transitioning into Medicaid Expansion. This webinar event has been brought to you by PCAD's Colorectal Cancer Community Partnership and CareSTL. The purpose of this webinar is to understand the current state of Missouri Medicaid expansion, the legal and political barriers that impact the expansion, and what resources are available to help individuals apply for healthcare coverage under the expansion. Before we start, I would like to inform you again that we have a pre-assessment poll displayed before you. The pre-assessment poll is designed to assess your knowledge on the different topics that we'll be discussing in today's presentations. There will also be a post-assessment poll displayed to assess your knowledge after the presentations. Today's presentations will go as follows. Mr. Lucas Caldwell-McMillan, Managing Attorney for the Legal Services of Eastern Missouri, will present first. Ms. LaChelle Livingston, Director of Population Health with CareSTL, will present second. And Ms. Dianne Carty, Director of Social Services with the Bilingual International Assistance Services, will present last. Please note that you will be muted during the duration of this webinar event. However, you will be allowed to list your questions in the Q&A and chat areas. We will also have a Q&A section which will allow you to submit your questions to each presenter. Without further ado, we will proceed with our first presenter, Mr. Lucas Caldwell-McMillan.
All right, good morning, everyone. Really happy to join you to talk about a great topic, Medicaid expansion. My job in the next 5 to 10 minutes, hopefully closer to 5, will be to give you a quick overview of Medicaid expansion and then pass it on to my fellow panelists for some more details. I want to start with a really brief overview. And today actually happens to be the 12-year anniversary to the day of the signing of the Affordable Care Act by then President Obama. So that's where we start with our history. And part of that Affordable Care Act, in fact, one of the essential parts of it was to expand Medicaid to adults who had income below 138% of the federal poverty level. And that's because in many states, including Missouri, many folks were left out of Medicaid, particularly childless adults who weren't disabled or pregnant were really left out of Medicaid. So passed in 2010, signed into law in 2010. If you recall, at the time, now President Biden said it was a big blanket deal. So we're also the 12-year anniversary of that statement. And it is, it's really important. In our state, things really didn't get going along until voters approved Medicaid expansion in August 2020, which added it to the Missouri Constitution. Again, a real brief overview. There were some legal battles, and finally, starting in October of last year, the state Medicaid agency called the Family Support Division, which is part of the Department of Social Services, began implementing Medicaid expansion, began signing up and approving applications for Medicaid expansion just last year. So who's eligible for Medicaid expansion? This is a pretty complicated slide. I'm going to get it down to the basics on the next slide. But some highlights: there are citizenship and residency requirements. You have to be a resident of Missouri to get Missouri Medicaid. One of the big eligibility requirements is you can't be on Medicare. You can't be enrolled or eligible for Medicare, not Medicaid, but you won't get Medicaid expansion if you're enrolled or eligible for Medicare. So lots of 65 and over Medicare enrollees aren't eligible. But the essential eligibility requirement is that middle requirement, which is you have to have income below 138% of the federal poverty level. That's really what it comes down to. You also can't be eligible for other Medicaid programs. So like if you're pregnant on Medicaid for pregnant women, you'll have to stay on that Medicaid program. But for most people, it boils down to having that income below 138% of the federal poverty level, which is a meaningless term that us wonks and experts use. But here's what it comes down. What is that income level? This is the monthly and yearly income level. So for most people in Missouri, if you don't have access to insurance and your income's below this level for your household size, then you're eligible for Medicaid expansion. You should apply with the Family Support Division, and you should be approved and start to receive Medicaid. So this is really what it comes down to. And this is really expands Medicaid to a whole host of people who were left out before for a variety of reasons. And that's that gap in this chart here. So who are the folks that before Medicaid expansion who were left out? So working parents. If you were working as a parent, you were likely going to make too much money for the parent-based Medicaid, and you were left out. Now with Medicaid expansion, you should be eligible. If you were a childless adult, you had no pathway unless you were disabled or pregnant. As a childless adult, you were totally left out. Now with Medicaid expansion, those folks are eligible for Medicaid. So students, working students who might be uninsured were left out. Now those students should be eligible. This last one is tricky, but an important one. I keep mentioning disability. So there is Medicaid and has been for a very long time, Medicaid on the basis of disability. But in order to get Medicaid on the basis of disability, there's a pretty strict test. And so if you had a disabling condition and didn't meet that really strict test for disability under the Medicaid program, you were left out. Now with Medicaid expansion, you don't need to go through the test of whether you meet the disability requirement or not. You just need to meet that income test, have that income below, for a single person, around $17,000 a year or below. That's all you need to do. So this Medicaid gap that for a long, long time, well after the 12 years the law was passed, still existed in Missouri, is now filled in. So who are those folks then are newly eligible for Medicaid expansion? That's estimated about 275,000 people in Missouri are eligible for Medicaid expansion. Most of those people, about 75% of them, are living below the federal poverty line, so living in poverty, really existing on pretty low income. But they are families with workers. So there is kind of a myth out there that folks on Medicaid expansion are not workers, but almost 80% of them are in a household with at least one worker, and almost half of them have a full-time worker living in the household. So these are really a working poor population who, for a variety of reasons, don't have access to other insurance through a job or other means. And because childless adults were left out for so long, now with Medicaid expansion, of the newly eligible, more than 3/4 of those, more than 3 out of the 4, are these childless adults who were not eligible before. So this is a real quick overview, but a lot of times you talk about Medicaid expansion, what are the eligibility requirements? So what is it? It's full Medicaid benefits. So it's equivalent to a full health insurance coverage. So it includes preventative care, specialty care, ER visits, urgent care, prescription drugs, includes dental insurance, which is unique compared to other health insurance coverage, but Medicaid includes some dental benefits as well. So it's really full health insurance. And the one thing to know about the coverage of Medicaid expansion is in Missouri, it's done through what's called managed care plans, which are private health insurance companies. And so when someone becomes eligible for Medicaid expansion, they will be assigned and allowed to choose between three of the available Medicaid health insurance plans. Those are home state health. If anyone's in the insurance business, that's a Centene company. United Healthcare has a United Healthcare community plan. That's the Medicaid plan of United Healthcare. And Healthy Blue is the local, let me get this right, used to be WellCare plan as well. And so they'll be assigned to one of these health insurance plans. And what that means is, for those of you who are familiar with work insurance or other insurance of your own, it means that the provider, the doctor they go to, the hospital they go to, needs to be in network for whatever plan they're on. So it does have a network as well. But the main takeaway is this is full Medicaid benefits, and it covers really a full range of health. Didn't mention mental health, absolutely should. Covers mental health services as well, but really is a full health insurance plan through Medicaid expansion. So now that it's the law in our state and part of our state, what are some of the legal barriers? Well, the first thing to know as far as Medicaid expansion is that in August 2020, when the Missouri voters voted for it, they voted to include Medicaid expansion as part of the state constitution, which means it can only be changed or repealed through changes to the state constitution. So it's not just a law in Missouri, it's part of the state constitution. That leads me to my next bullet, which is House Joint Resolution 117, which is currently being considered. I believe it's now over to the Senate. This is a resolution that will be passed through the Missouri legislature, which would then put on the ballot changes to the state constitution, which would allow the Missouri legislature to repeal Medicaid expansion, make changes to Medicaid expansion, change the benefits in Medicaid expansion, all the things they can't do right now because it's part of the state constitution. It would allow them to roll back Medicaid expansion entirely. So that's a potential legal or political barrier on the horizon. It has not been passed out of the legislature, but is currently being considered in the Senate. And then the last barrier that I'll mention is that implementation has been very rocky. I think some of my other panelists are going to give you more details about their experience helping folks enroll in Medicaid expansion. But I'll just say that the biggest threat or barrier right now to Medicaid expansion is how our state agency implements it, how they process applications and things like that. And that remains a concern for those of us who are very excited about Medicaid expansion and what it brings to our state. But are concerned that if we don't have it roll out correctly, make an easy path, that then we're going to leave lots of folks out. And the last thing I'll say from a health equity standpoint is that I glossed over these changes, but some of the folks that are left out in our state are undocumented immigrants who are not eligible for Medicaid expansion, and certain other immigrant categories are also left out of Medicaid expansion. So from a health equity standpoint, I think that's important. Although Medicaid expansion covers those 275,000 adults, there are still some populations and residents of Missouri that are left out with Medicaid expansion. I think we're gonna have time for questions at the end, but I think that brings me to the end of my slides. There's my contact information. I will say I'm currently on vacation, so don't call me today, but I'll be back in the office tomorrow. So feel free to reach out for me with your questions or concerns, and I know we're gonna have a Q&A at the end. With that, I'll pass it over to LaChelle Livingston from CareSTL.
Good morning. Thank you, Lucas. As Lucas said, I'm LaChelle Livingston from CareSTL Health. I am the Director of Population Health. And as the Director of Population Health, I oversee our outreach department and our community health workers that are in the population health department. And so those outreach workers and community health workers are certified application counselors who help assist our patients and our community members with signing up and filling out those Medicaid applications. And our community health workers do that as well. So as Lucas did say, there are a lot of benefits to Missouri Medicaid expansion because there were a lot of people that were left out of Medicaid. And so, like he said, there's over 275,000 adults who are eligible at this time who were not covered before, because previously it was a very limited community that had access to Medicaid. So now it covers adults whose monthly income as individuals is $1,481. And so they no longer need to be disabled or have qualifying children in order to get the benefits of Medicaid. And so it allows more adults to be covered. This slide just overviews who all is eligible. As Lucas said, I've highlighted those populations who were not included before. So parents and caretakers, women with no health insurance, adults without disabilities and without children, and those who are blind or visually impaired. I also wanted to speak to Gateway to Better Health. So in Missouri, because Medicaid did not expand and because it was a limited population, we implemented in 2012 Gateway to Better Health, which was a temporary coverage to kind of bridge the gap of those communities who were eligible for Medicaid and those who were eligible for other private insurances. And those people who received Gateway to Better Health, they did not qualify for either. They didn't have enough income to afford insurance, and they had too much income to get Medicaid, or they, didn't have children. So this allowed over 66,000 St. Louis area residents to have access to medical care and medical services. So actually with Gateway to Better Health, because Medicaid expanded, it is projected to end at the end of this year. So that means that that's going away. So we need to get these people and these community members signed up for Medicaid, because a lot of them should be eligible. And what a lot of Gateway to Better Health members do not know is they will not be automatically converted to Medicaid. They will need to fill out an application. So they do need to seek out assistance, or they need to go on Department of Senior Services website in order to fill out this application. And so CareSTL Health is acting as an advocate for these community members and for our patients. So our outreach workers and our community health workers are assisting patients with filling out these applications, because sometimes they are hard to understand and some people do have difficulty, and they are very extensive. So we are taking walk-ins, so you can come in and just say, I need to fill out a Medicaid application, and we are happy to help. They'll take you to the outreach department and someone will assist and walk you through each step of the application process. And if people are not able to come in, we are available by phone, and our staff will assist you over the phone as you fill out your application on the computer at home or at the library or wherever you are. And so not only do they assist, but they follow up with the Family Support Division when applications are still in the pending status after 30 days, because we should be seeing some movement, because we don't want people to continue to have to delay going in to seek care for any kind of health issues they might be having. So our enrollment efforts, like I said, we are taking walk-ins to come in and do applications. We are actually hosting Medicaid application blitzes. Lucas's team is actually assisting us with that. They come in and assist our staff to do those applications. We set up in the lobby. We have availability in our offices. Our registration staff is passing out applications. We are trying to do everything we can to help get the word out that people should be applying for Medicaid because they're most likely eligible now. For our uninsured patients, when they hit our registration staff and we see that they are uninsured, we're creating a list, and that list is being forwarded to the outreach and community health workers so that those people can be contacted to let them know, hey, we see you're uninsured. You may be eligible for Medicaid now. Can we assist you with completing an application? We have community partnerships where we're going out into the community and assisting as well. And our marketing team is putting all of the information on our social media, so Instagram and Facebook, to get the word out about who's eligible, how we can assist, and to let people know that we are available for them to come to us. This is a flyer that's for this month of the 3 different medication application blitzes that we are having and have had. The contact number for the outreach department is on it for reference. And so now I want to go on to talk about the barriers, because although Medicaid expanded, we have noticed that our patients and our community members are experiencing a lot of barriers, but also the Family Support Division, they have a barrier for themselves because they are very short-staffed. And they're accepting paper applications, and they also have a portal, but we have noticed that paper applications are taking longer because they're short-staffed, so they have to have someone to process these applications. And so just a week or so ago, we were notified that applications are possibly taking 99+ days to be processed. In addition to that, there are incomplete applications due to individuals lacking the knowledge of what all needs to be filled out and the required fields that need to be completed on those applications. We're having to resubmit applications because of the system issue. There are 80-something thousand people who have applied for Medicaid so far. So just imagine how overwhelmed their system is with processing applications. So we've had to resubmit. Another thing we have noticed is that applications are getting approved in the Missouri Eligibility Determination and Enrollment System, or MEDIS, which is what a lot of people know it as, but they're showing that those approved applications are inactive in EMOMed, which is the Electronic Missouri Medicaid portal for Missouri Department of Social Services. So this in itself creates a barrier because when patients come in, they go and see the doctor, is showing that they're not covered. So then the billing department is charging for medical services. And when they're going to the pharmacy to get medications, they're being charged for their medications, when in reality, they are approved and they shouldn't be. And so this causes a barrier for us as a healthcare provider, because our billing department is seeing this inaccurate Medicaid status when we should be billing Medicaid, but we're billing the patient because we do not see that. So some great resources that we have found to help us manage some of these barriers is, like I said, people are able to go on to mydss.mo.gov website and actually complete their applications in the portal. The Missouri Primary Care Association has been a great resource for us. They've assisted us with urgent needs for patients who have submitted applications and they still haven't been approved. The St. Louis Regional Health Commission, they've assisted us with delayed applications and getting those, if they were found or pushed through, so that those patients are not charged for the visits that they have had. CMS has some great resources for those who need coverage. And like I said, Lucas's team at the Legal Services of Eastern Missouri has been great as well. They are assisting applicants when their applications are not being processed in a timely manner. They have a way that they can assist as well. This slide is just to show the different services that CareSTL Health offers. As I said, we are a full service federally qualified health center. We range from adult medicine to women's health services. We do telehealth, COVID testing, and also for these uninsured patients or patients who need Medicaid, we offer behavioral health services that include Medicaid medication assisted treatment, because opioid awareness is a big thing that we focus on. And our outreach department, like I said, they assist with Medicaid applications and in providing resources to community members and patients that need them. So this is our contact information. Uninsured and underinsured individuals, please call us at 367-5820. The outreach department has a direct extension of 2294. They can assist individuals with applications. And we do have multiple locations, and we also have school-based locations. Lucas mentioned that a lot of immigrants are left out of Medicaid, and we are actually seeing that at some of our school-based locations because some of those students are immigrants and refugees, and so they are not eligible. And so we're trying to find ways to assist them so that they can receive coverage as well. And that completes my presentation. I'm going to pass it on to Dianne.
Thank you so much, LaChelle. Good morning, everyone. I'm going to share my screen here. All right. Thank you for having me here today. I'm really excited to be asked to be one of the presenters. I'm from an agency called Bilingual International Assistance Services. My name is Dianne Mogilevsky Carty. I'm the Director of Social Services here. And just to tell you a little bit about the agency, we are a St. Louis-based nonprofit with over 3,500 direct service recipients annually, a third of whom are seniors over 60, and almost everyone are immigrants and refugees. The agency was established in 2002 by stateless refugee women from Soviet Union because they wanted to make sure that their families had access to navigating the intricate system of care in St. Louis, Missouri. And they wanted to make sure that they were lessening their anxiety and fears over their future. So free from negative bias, we advocate for appropriate health and social services for underserved populations in St. Louis. So our agency does a lot of different things. Primarily, it's mental health, language services, and social services. So under the mental health, we have and I'll go over these in a little more detail on the next slide, but we have our biggest program is called St. Louis Partnership for Survivors of Torture and War Trauma. It's an integrated treatment team to provide mental health therapy, psychiatry, case management, and immigration and legal assistance to survivors of torture and trauma. There's also something called Project Safe Space, which is providing children's mental health therapy services and family case management to both the caregivers and the teachers. The program is held in schools. And then there is an adult wellness program called Steps to Better Health that is kind of a standalone program from the rest of the mental health department. Focuses on counseling, nutritional education, and medication management. Our language services department has interpretation and translation. And we are a contracted provider with the state of Missouri for over 40 languages. And then on the social services, there's 5 major funding sources. We provide care coordination, case management, benefits assistance, health insurance literacy, health insurance navigation, and also naturalization services for elderly refugees and legal immigrants. We also have a Macklin Senior Center. It is an international senior center for our clients, the immigrants and refugees. However, they're closed right now. We're hoping to reopen soon. So a little bit more detail on the mental health. The St. Louis Partnership for Survivors of Torture and War Trauma is a program that's been 18 years in operation. It was founded in response to the struggles of the Bosnian survivors in St. Louis as a multi-agency collaborative, but now is operated almost exclusively by Bilingual International Assistance Services. So the goal is to provide special trauma-focused services to help survivors adapt and thrive in their new lives in St. Louis. It's supported primarily by grants. There's the Office of Refugee Resettlement, the Survivors of Torture Program, the Care Access for New Americans, and United Nations gives us a small grant for family therapy and case management. The process goes as following. So there's a referral process, intake screening, treatment planning, providing service lines, and then discharges, which are right now taking longer due to COVID and the USCIS delays. So it's taking time to graduate out of that program for some of the clients. We also have, like I said previously, the Project Safe Space, which is a school-based, school-centered behavioral health intervention for immigrant and refugee children. It was started at the Whittier School District with Spanish-speaking population in 2015. It has expanded to other area school districts in St. Louis City, St. Louis County, and charter schools in St. Louis City. They utilize fully licensed mental health therapists. Students have to be either ones that are exposed to traumatic experiences or appear that they had difficulty with adjusting to their current cultural and language barriers. They serve children K through 12, and students would be foreign-born children, English language learners, and children of foreign-born caregivers would also qualify. Like I said, it's primarily for the children themselves, the caregivers, and teachers can receive support as well. They meet for 1 to 2 times a week, 30 to 90-minute sessions, and for 1 to 2 semesters. What they found is that they're serving more boys versus girls, more elementary school children, and then more family case management has been needed, especially due to COVID. There's definitely still a majority Spanish speakers, mostly in St. Louis County. And there's a lot of family separation cases that are for the children that are part of this Project Safe Space. The Steps to Better Health is, like I mentioned before, is kind of a standalone program really focused on helping St. Louis City residents who are 30 and older, mostly live in North City, and who have some kind of a comorbid diseases that they need help managing. And so for a lot of these are things like diabetes, high blood pressure, high cholesterol, and making sure that people are able to reduce stress, get into a routine. They get nurse visits. There's also interpretation services available, and clinical case management goes along with it. So our next big service department is language services. I kind of put some information on here that you can kind of see who our major translation partners have been, the top 5 languages by appointment requests. We have professional interpreters that provide clear communication in both languages. There's a strict compliance for HIPAA privacy laws. And our interpreters attend a variety of appointments, anything from medical appointments, driver's license, permit exams, naturalization interviews, social security and public benefit appointments, mental health therapy sessions, court hearings, just to name a few. In terms of translation, we work usually on things like birth and marriage certificates, academic transcripts, educational records, IEPs, for that project safe space, especially medical records, legal contracts, public outreach media. I will actually show in the next few slides some of the work we've done with the Missouri Foundation for Health. So, and then this is my department, social services. So like I said, the agency was started to advocate for and assist the aging foreign-born populations in St. Louis metro area. All the logos that you see are from our main funders. We are providing social services quite a bit. We have a pretty big contract with St. Louis Area Agency on Aging, the Macklin Senior Center, which is not open right now, the Medicaid Expansion Outreach and Enrollment Grant through Missouri Foundation for Health. The St. Louis City Senior Services Fund is designed to combat isolation in seniors who are city residents who are staying home right now and homebound really due to the pandemic. There's a senior companion program with LifeWise STL. We also work with CLAIM, the state health insurance assistance program that is statewide to help with counseling for Medicare and Medicaid and for counseling and enrollment into those programs. And like I mentioned, the naturalization services for elderly refugees and immigrants, a grant that we have through Missouri Department of Health and Senior Services, and it's statewide. We have several partners in Missouri who are assisting us to make sure that we meet our quotas annually. So moving on to Medicaid expansion and the outreach that we're doing. So the Kaiser Family Foundation reports that in 2019, 29% of Missouri population was low income and only 15% of Missouri population was covered by Medicaid CHIP. So these are our, so as Lucas showed in his presentation, there is that big hole that who does it cover, and that's the coverage gap. And so these are adults with disabilities, uninsured adults, or I'm sorry, adults without disabilities, or ones who don't get, or adults with disabilities who don't receive the SSDI, the disability income. They're childless adults, adults at jobs that don't offer employer-sponsored insurance, but are not able to get the Affordable Care Act, the Obamacare, because their incomes are so low. Also, the multi-generational families living in the same household often don't know that they will, some people in the family will qualify for different health insurances options in Missouri. And so we work primarily, like I said, with immigrants and refugees, but also a lot of these other target populations here on the left that are really our populations that we're trying to outreach to. So we're doing a lot of external outreach, attending community-wide outreach events throughout the city and county. We're also going out and creating our own enrollment events in places of worship, in a lot of the local immigrant and refugee-owned businesses. The staff are available on site usually initially for just outreach events, and then we'll make connections and make sure that we come in for several weekends in a row, often to do the enrollment events with clients, because a lot of the staff on the social services department speak a different language. It also helps with making sure that we're able to assist people whose English, for whom English is not their first language. So staff are often providing health insurance literacy, counseling, enrollment assistance, and are available to answer questions to clients in their own language. We provide marketing communication in multiple languages. And if I can do a little plug here for our language services department, we create a lot of the media toolkit that Missouri Foundation for Health created. Our language services department translated, and it's all available on the website. And I have the website address listed here at the bottom of the screen. So when you get a copy of the presentation, feel free to take a look at that. We have, let's see here. So kind of going over the barriers for approval, what is going on right now. I know Lucas and LaChelle both have mentioned some of these things. I also wanted to talk about this. So there's 64,000 that have been approved so far. However, the current backlog is anywhere from 72 to 73,000 applications still waiting. There's 2,500 cases being approved monthly, which is down from 2,000 a week in the previous month, and down from 3,900 per month in January. The delays are due to large increase in populations. Large increase in the applications. And there has been reports of people submitting several applications, either because not knowing that they don't have to do that, or because there's simply not, the system is not robust enough. Unlike if you're familiar with Affordable Care Act, you can get, you know almost immediately whether you're approved or you're denied coverage. So sometimes people will submit multiple applications, or some will submit, let's say by mail, by fax, by email, because that's the approach that was used before when we were using paper for, let's say, Medicaid applications. And so just to make sure that the family support got it, we would send it 3 different ways. Well, now I feel like that's a detriment to the process for sure. So the 45 days processing time is the federal limit to process these applications. Currently, the processing time is 119 days, which is almost 4 months. It seems unbelievable that it has to take that long to get applications approved. Also, there are a lot of mismatches through the LexisNexis, which is usually used to verify income and address information. Some of the applicants are being erroneously flagged as living out of state and receiving a rejection for benefits, especially those which have, very similar names like John Smith. I don't know if there's too many Dianne Mogilevskys running around. I think I'm the only one in Missouri, but definitely for Americans with similar names, that has been causing the most problems. And apparently some of the things that the state workers have said is that they want the clients to call LexisNexis and make sure the problems are being fixed. Well, I'm sorry, I do not see anyone who speaks Vietnamese calling LexisNexis and saying, hey, you have my address wrong. So there's quite a bit of work that still needs to be done on this point. There's also a lot of problems going on with closed offices at Family Support Division, workers being sick with COVID. So the staffing challenges are also related to low pay, and the worker turnover at Family Support Division is close to 40%, which is really very high. And then going on to other programs, not counting other applications for other MoHealthNet programs. There's extremely long wait time to reach Family Support Division. My caseworkers report anywhere from 4 to 5 hours daily per case, and only being allowed to do 1 case per call. Before the public health emergency, the Missouri Family Support Division regularly reviewed whether people were still qualified for safety net programs like Medicaid based on income, age, and disability. But that has been suspended for the past 2 years, as the public health emergency is slated to end on April 16th. Those interviews will need to be completed again. The recertification periods will be back. Excuse me. And so many can lose eligibility if they were appended from jobs or housing during the pandemic because they can't verify the residency or their legal status. So whether people don't receive or the recertification paperwork or they've moved, 80 to 90% are at risk to lose Medicaid benefits due to incomplete renewals. More often than not, it's those that simply don't return the information that will be the ones that will lose the benefits. Another thing that would help a lot is having the Tier 1 access to the FAMIS MEDIS databases to check for application completion. This is something that Bilingual International has requested in a MOU with the state of Missouri, but we're denied. So we're now looking for partners to create that MOU and to make sure that our managers, our case managers would have access. Even if just our office had access, that would ease the burden of the backlog tremendously, because if we knew that it was a matter of sending in some paperwork in order for the clients to get approved, then that's something we don't have to wait a week or 2 week turnaround until the client gets the letter and then gets the information that they can send and sends it back, and then they would be approved. So that's definitely something that we're looking to partner with someone on. The idea going forward on all of these is that everybody who's eligible for MoHealthNet is getting coverage that they need. And that should be accessible to everyone. Okay, so here are some resources on our end. The mydss.mo.gov is the primary site for Family Support Division and Department of Health and Senior Services. Information is available there. There's FAQs about in plain English about benefits, the cost sharing details, income guidelines. And it's also the second link is where you can check the status of your Medicaid application. It also works for all the other Medicaid applications besides Medicaid expansion, as well as food stamps, TANF and CHIP public benefit programs. So it's updated in real time. So, and all you need is a date of birth or a social security number, date of birth and a social security number to check if the client's benefits have been turned on. So that's something we've been using because we don't have tier 1 access. The spend down link here is information about spend down, one of the oldest and hardest programs to understand for many. There has been some talk about transitioning some people who already have spend down now. Unfortunately, what the state of Missouri is doing, instead of transferring everyone who would qualify for Medicaid expansion from spend down, they're letting people have that as a option. So I've talked to several people who have spend down who say, why would I need to change? I know what I'm doing. I rather pay my spend down, and which to me seems very strange, because when you can have Medicaid expansion with all of the benefit it provides without having to pay a monthly premium. So then the next few links are for Social Security and Medicaid and how the two work together. Social Security has been really good in the last 2-3 years. They've transformed themselves. They put a lot of their documents online. It's actually, they've made it difficult to find a paper copy of a form and print it out. But so the links here explain in detail how Medicaid works with SSI, SSDI, and other state-run programs. And then there is a link for Needy Meds, which is a link provided to us by another funder. And it shows a listing of state-sponsored programs that provide medical care, financial assistance, and other resources for health insurance and medical supplies. And then to find us, Bilingual International Assistance Services, you can find us through healthcare.gov under local help and covermissouri.org under local help. And that's it. This is our contact information. So I will just ask you, who do you know who needs Medicaid? Send them our way. We provide bilingual caseworkers who are available to assist, whether in person, over the phone. Any of the programs listed here, Medicaid, Affordable Care Act, Medicare, and any other social services assistance. So that's my presentation. Thank you so much.
Thank you so much, Diane, and to each of the panelists, Lucas and LaChelle, for those wonderful presentations. At this point, we will turn to our Q&A session. We've had a lot of questions that have been coming through the chat. I want to remind everyone that if you have a specific question that you would like to have answered by any of the panelists, please go to the to section of your chat and select the individual that you would like to refer your question to. We have a lot, but before we continue, there are some questions that we did have a chance to jot down. And the first question is, does anyone knows how long a patient has to hear from the Medicaid division? What's taking so long for patients, hospital patients, to hear from Medicaid division?
I don't know that one. Why hospitals specifically?
Yeah, I mean, I think the best answer to that is that as applications come in, they're all part of the same backlog that Diane and LaChelle have mentioned. And so that right now there's a whole host of factors that mean that the average processing time is over 100 days. The law requires approval within 45 days, but currently our state is nowhere close to meeting it. And that's for health center patients, people applying on the website, people applying from the marketplace, hospital patients. Everyone is caught up in the same backlog.
Okay, and I think the next question was referred to you, LaChelle, and it was answered in the chat. But one individual asked, where is CareSTL taking walk-ins and at what locations?
So we're taking our walk-ins at all of our locations. So our main location is on Martin Luther King. It's 5471 Dr. Martin Luther King Drive. Actually, let me just share my slide. Our another location is 2425 North Whittier Street. Our Riverview location is at 5541 Riverview Boulevard. Our Pope location is at 4500 Pope. And our West Florissant location is at 10135 West Florissant.
Thank you so much, LaChelle. And also I would like to mention that there are other federally qualified health centers that are on the call today, like Affinia Health. They are also assisting individuals with Medicaid applications. I think we have Family Healthcare online as well. They will also provide information on their time and location. And of course, everything that's displayed in the chat will be saved and submitted to you all at the end of this event. Okay. And so there was another question that came in, and it says, if someone qualifies for Medicaid under the new adult expansion, and down the road they started earning $17,000, will they be required to update their coverage status, and will they lose coverage?
So the answer to that question is yes, they will be required to update, and they have to update whether their income increases or decreases. And so, I mean, as we've talked about, there's a serious delay. So there is no real time frame on when. It just depends on how long it takes to process that information through the system. But you would receive a notification in the mail letting you know when your coverage would end. It wouldn't just end and you not know anything. Oh, Lucas.
And I was just going to add to that. LaChelle's absolutely right. And the other tricky answer to that question today is that we're currently under a federal HHS declaration of a public health emergency, which means that Missouri is not terminating anyone from Medicaid. For really only reasons of death can someone be or moving out of state, can they actually be disenrolled from Medicaid currently, because we're under a public health emergency, and that protection will last at least until the beginning of July. And so and it may be further, but so LaChelle's right that they'll have to process it, and even if they process it now, they won't cut anyone off because of that public health emergency. But once the public health emergency is lifted, then it would be back to LaChelle's answer, is just as soon as they process it, they would send a notice saying they lost coverage. The other twist, and I'm going to jump into the weeds. You guys maybe do a brief overview, so I'm going to jump into the weeds. The other twist to the question of, okay, you start making more, the example of, okay, you start making more money than $17,000. I think Dianne and LaChelle both mentioned marketplace insurance through healthcare.gov, and they both offer assistance for that. The way the Affordable Care Act was designed was to offer coverage at all sorts of different income levels. And so once you go above 17,000, if you're a single person, 17,700 yearly income, then you should be encouraged to either go to an assister or yourself go to healthcare.gov and look at the insurance options that are available through the marketplace, so the federally facilitated marketplace as well, so that they can hopefully have continuous coverage, even though they won't be eligible for Medicaid anymore.
Thank you so much, Lucas. And we have another question. If you are denied Medicaid expansion coverage and appeal the decision, about how long does it take? How long does the process take?
Yeah, generally under 90 days is what the law requires from the date of appeal, really from your date of notice, but generally around 3 months. Actually, the appeal system is actually working quicker than that. So you might actually get a decision quicker than the 90 days, but that would be 90 days from your decision to appeal the denial. LaChelle, Dianne can correct me if I'm wrong, but denials of Medicaid expansion, in other words, you apply and are denied, have not been a major issue at all. From what I've seen, the major issue is the delays. We're not seeing large numbers of people. And I'll just be frank, I haven't seen, and we get a lot of calls, I haven't seen a single denial on a Medicaid application or Medicaid expansion application. So at least currently, that's not a big concern. But I certainly, if you are denied, I would encourage you to appeal, particularly if you think you meet the criteria for Medicaid expansion.
Thank you.
We've done a couple thousand applications just this year, and I think we've only seen one denial. And it was because the application wasn't completed correctly. So that's why I say a lot of people are not well informed on what all the necessary information is that they need to include in their applications. And so that can cause denial, and then they'll have to redo the application.
We have seen a few denials come through, but the only way that we've known that it was a denial is not because someone necessarily received a letter, but because they didn't receive it for so long. So then we go through and we look like, was this person really supposed to have applied? Because a lot of people have come to us after they've submitted an application on their own and have not received anything to say, yes, you were approved. So if you're waiting for like anything over, in general, if you're waiting anything over 3 months, a lot of our caseworkers have dealt with appeals and have filed appeals on behalf of our clients. And often, like Lucas said, they will go through, but sometimes they're not even, they don't even know they've been denied. So that has been another big barrier, is not even receiving anything that says either yes, you're approved, either no, you're not approved, or here's your card. No, nothing. That's why that check status link that I provided at the end of my presentation has been tremendous way for us to use every day.
Thank you so much, Diane. We have another question in, and it's more policy related as well, Lucas. Is it true that the Republicans, GOP, is trying to add a work requirement for the Medicaid expansion applicants, especially those waiting for months for qualification?
So to the latter part, there's going to be no work requirements implemented for the people waiting at this time. There's no plans. There's no current, policy in the works about that. So I don't want to alarm anyone. Anyone who's applying now or is on Medicaid expansion now should not be worried immediately about work requirements. Long-term policy, I mentioned HJR 117. That was that resolution that was going to make changes to the state constitution, or put it before the voters on the ballot to make changes to the state constitution. If that resolution proceeds and is approved, that part of the threat to Medicaid expansion through that resolution and ballot initiative is work requirements, along with, like I said, rolling back Medicaid expansion entirely. And so, there are certainly long-term threats to Medicaid expansion, but anyone applying today should be encouraged to apply, encouraged to use and get their coverage, and there are no work requirements at all currently.
Thank you. And there's another question that was sent. Although there is a backlog, once an eligible person signs up for Medicaid expansion, are they immediately accepted for services?
So for us, once they complete their applications, I mean, even without completing the application, we are not denying service. And so what happens is once you are approved, your Medicaid starts from that date of submission of your application. It's not the date you get approved. So if you have to go to the doctor 3 or 4 times and then you get approved, those visits would be retroactively covered.
And just to follow up with that, LaChelle, I'm glad that you mentioned that. Could you explain to everyone what is retroactive coverages? What are retroactive coverages?
So essentially, they would go back to the date that you originally applied and cover everything from that date forward.
Actually, one thing I did want to clarify on that, LaChelle, is that they will only cover for places that are Medicaid, that accept Medicaid. So if you went to a doctor who does not accept Medicaid, they will not cover that. I had to clarify that myself.
Yeah, that's absolutely true. I'm speaking from a federally qualified health center. So like I said, we do accept Medicaid, yeah.
Yes. Yeah, having that we deal with Medicare and Affordable Care Act, like, you know, full spectrum of health insurance. We've had to clarify that.
And we are checking the chat to receive any more questions. And now we have our poll assessment that's coming up. Please take the time out to fill that out based on your knowledge from what you've learned today. And in the meantime, we do have another time for some more questions. There's another question that came in and it says, how can one find out who and what doctors accept Medicaid?
Unfortunately, it's by calling around. And as far as I know, there's nothing that's available as a like something that's available for everyone.
Yeah.
So this is, oh, go ahead.
Oh, go ahead, Lucas.
I just put in the chat, as I mentioned, for most people on Medicaid expansion, they'll be assigned to one of 3 managed care
Yeah,
plans.
That's what I was
And so the link I just put in there will give you a link to online provider directories for Home State Health, United Healthcare, and Healthy Blue. And so you can certainly look up providers through those online directories. When I work with patients directly, and certainly in my own personal life, I always say, check the directory, and like Dianne mentioned, call the doctor. Because you don't want to be stuck with a bill, which is what would happen if you went to an out-of-network provider. And so particularly if you're outside of the federally qualified health centers like CareSTL and Affinia was mentioned, that's particularly true. So you can check the online directory that I just linked to your assigned Medicaid managed care plan. And then it's always a good idea to call the office ahead of time before you get treatment, just to double check that it's accurate.
Yes, and then I will also say that once you do apply and receive your notice that you've been approved, usually you are assigned to a provider. So it will let you know who your provider is. So you do not actually have to search for one. They'll assign you to a provider. It should be in your packet. And then you can just go from there. But if you do want to switch, as Lucas said, there's a directory that you can go in and look for a different provider.
Okay, I would like to thank you guys for that information, very insightful. As the poll test keeps coming in, the results, we have some information listed before you in the chat, but we would like to take this time out to see how everyone has done on the poll test. This is the time for our panelists. If you would like to discuss your questions and what's the correct answer, feel free. And so what we can do is I will read them out one by one, and we can just figure out who basically did well during the discussion. So let's start with a true or false. Medicaid expansion cutoff is 138% of the federal poverty level. Is that true or false? Most people said true. Is that correct? Great. True or false? Before Medicaid expansion, childless adults could only receive Medicaid if they were disabled or pregnant. True or false? All righty. The next one is true or false. Medicaid expansion is a part of the Missouri Constitution. True or false?
Did you want us to jump on and say that true or false? Oh yeah, so it looks like everyone got that one right. That is true. So I think I think I stressed that enough during my presentation, but yes, that's true.
Great, great, great. And so the next question is, it is best for individuals to complete Medicaid applications alone. Is that true or false? And you can jump in and explain at any time.
It's definitely false because of all the different complications. And it's just sometimes it's difficult to understand. It's very extensive application, so it's definitely false. It would be best that you seek out some help.
Right, and especially on our end, we found with working with immigrants, refugees, foreign language speakers, that people get kind of anxious over how to answer the questions, who lives with them, especially in those multi-generational households. Who do you include on the application? Who's on your taxes? Do you have to file taxes? You know, there's so many nuances to it. So yeah, I would definitely suggest to, even if you fill out an you want to fill out an application on your own, just talk to someone, ask someone a few questions.
And so I'm scrolling back up and I have one question that needs to be answered. And that is the average processing time for Mo Health Net expansion application is 90 days. True or false?
Not right now.
Okay. And so I think we're heading down to our last question. True or false? Once individuals complete Medicaid applications, they do not experience any barriers or coverages from coverages. Barriers to coverages, sorry about that.
Oh, that's false. That's false, as many have experienced. And as we as providers are experiencing, like Dianne spoke about, everyone is experiencing barriers because, I mean, everyone is short-staffed. And they're just so, like, the system is overwhelmed. The system is overwhelmed. So there are a lot of barriers occurring.
All right.
Yeah,
So
even beyond, I was going to say, even beyond just receiving, let's say you do receive a letter and that says, hey, you qualified. Knowing where to go if you're not in a major city, or knowing where the doctors are. There was a study done with St. Louis University Law School, with Sydney Watson did, that just looked at different hospitals that are in different Medicaid expansion managed care programs. Each of the health insurance providers, and how often they switch, and some drop off and some get back on. And yeah, it's overwhelming how many barriers remain even after you get past the application process.
Okay. So thank you all so much again for attending our webinar event, Understanding Healthcare Part 3, Transitioning into Medicaid Expansion. I would like to thank our panelists for their participation in the wealth of information that we have received today. Be sure to follow PCAD at our Facebook account for more webinars and in-person events. We greatly appreciate everything. And once again, I'm Dr. Keisha Wyndham, and this has been Understanding Healthcare Part 3. Thank you.